Hi, my name is Andrew Sears, and I'm the president of City Vision University, and I want to talk about City Vision's interdisciplinary approach to trauma-informed care. One of the biggest challenges, everyone who talks about trauma-informed care, they're often talking about, one part of the elephant, but really having a trauma-informed care organization and practice throughout the organization is actually an interdisciplinary problem. So most people and most organizations and most universities really don't train across the disciplines for that. And I want to talk about how we do that. So part of the reason why trauma-informed care is a top priority for City Vision is more than 90% of our students work in a high trauma environment. We have students from hundreds of partner ministries and organizations that serve the poor, individuals that are coming from a background where they're homeless or addicted. And trauma-informed care is just absolutely critical. So another reason is we're particularly focused on addiction recovery and addiction counseling. Many people realize there's a strong correlation between trauma and addiction. And City Vision has 33 addiction-specific courses. To my knowledge, that's the most courses out of any Christian university in the world that's focused on specifically on addiction, not just general counseling. And another thing is we're particularly focused on organizational health and culture, and that's reflected in our core values and the courses and how we design our programs. So if you look at the models for trauma-informed care, probably the most popular, especially among our audience, comes from SAMHSA. That's the U.S. government's addiction, a group that works with addiction recovery programs. And this is their framework. It's called TIP 57, and it's their trauma-informed framework. And this kind of shows their book that they provide on this. And you see that there's many things that they talk about, trauma awareness, understanding the impact of trauma, screening and assessment, clinical issues, trauma-specific services. This really is a clinical counseling. This top part is generally going to be in the field of clinical counseling. Now, some of this also, is going to relate to the organizational in terms of training, but then there's another section that they have, which is, part 2 of this, and it's how do you implement this in an organization? How do you create a trauma-informed organization, and how do you build a trauma-informed workforce? And what's important to recognize is these are two different disciplines. So if you get trained as a counselor, you're not going to be trained generally, how do you roll this out in a whole organization? How do you build healthy organizations? Because generally a healthy organization is a safe organization and vice versa. And most counselors aren't trained in organizational management. So you need kind of this interdisciplinary approach. So with that, let me just provide a framework for trauma. So there's a lot of different types of trauma out there. So there's childhood trauma, often talked about, adverse childhood experiences or ACEs. There's trauma from sexual assault or violence or domestic violence. There's trauma from war and veterans. There's racial or gender trauma. There's trauma from poverty, from illness, pandemic, disaster, crime, working in the criminal justice system, refugees. So there's all sorts of trauma that's out there. And in terms of, the clinical side, often, the two frameworks, and this isn't currently in the DSM, but it's in the international counterpart, and generally almost all clinical counselors use this, even though it isn't in the DSM, is the distinction between PTSD and complex PTSD. So PTSD typically is caused by single short-term traumatic events such as car crash, sexual assault, natural disaster, or war, whereas complex PTSD is caused by repeated trauma that often happens over an extended period of time. It could be from childhood abuse, domestic violence, torture, living in a war zone. And the reason why this distinction is important is because the treatment approaches and what type of treatment you need to do really differs depending on which of these that you're dealing with. There's similarities, but there's also differences. So I'm not going to go into all the details. We have courses that go into that. Now, another way of looking at trauma is to recognize the different levels of trauma. So you have individual trauma and interpersonal. So that would be, through relationships. And then you might have community or organizational trauma. So interpersonal might be, domestic violence or things along those. But community and organizational. So if everyone you're living in an environment where everyone around you is experiencing trauma, that's going to be community or organizational. Then you have societal trauma and different times in history. And you're going to have different characteristics. Now, what's important is, and this isn't entirely true, but clinical counseling is most effective at the individual and interpersonal trauma. Now, someone who experiences all of these, it can be helpful for healing from those. But then there's kind of the question of how are you creating health in an organization. So the question of how do you create health in an organization, that's really a problem of management. How do you, run an effective organization, a healthy organization? So that's a different field. And then you have, how do you create political systems, a societal culture and society that's, reducing trauma and increased safety. That's also a different field. So if you look at, these different domains, that explains City Vision's different courses that we provide that support trauma-informed care. So at the base level is personal trauma recovery. So that is, many of the staff that we work with, about a quarter of our students are also program graduates of recovery programs, but a lot of staff who go into this field, they have backgrounds of trauma. And dealing with that on a personal level, obviously most of that's going to be done through counseling and group counseling, but we also have courses that help kind of provide a roadmap for that. So our Wounded Healers course helps provide a roadmap for that. Our Family Issues and Recovery, in addition to training people to be a counselor, you're processing your own family issues. And many of our addiction counseling and ministry courses can help our students in their own personal trauma recovery. Obviously, you need to be doing that with someone who's very clinically experienced alongside, but this will help in that process. Now, then there's the clinical perspective, and we have 3 main courses that are focused on that. So trauma and recovery, that's the undergrad trauma course. Trauma and crisis counseling, that's the graduate course. And then we have managing residential recovery, where being trauma informed is a component of that. Then you have the organizational perspective, and we have a course in cross-cultural management and ministry where a significant part of that course is developing a trauma-informed organization as a part of the culture of the organization, and then organizational behavior, developing healthy organizations. A big part of that is if you can create a healthy organization, then you are providing a much more trauma-informed approach, because you're trying to create a safe organization. And ultimately, all of our organization courses are working to try to help build healthy organizations, and they'll help in that. And then we have courses that really do the deep dive on the cultural side. So Christian community development and the social justice tradition, and leadership in diverse and under-resourced communities. In particular, they deal with issues around racial trauma, around some of the gender issues, but how do you create organizations whenever you have a diverse workforce that is going to be safe for people coming from different frameworks. So that is across the board for our courses. Let me just go and do a little deeper dive on our personal trauma recovery. So we have a program called our Wounded Healers program that is for program graduates of residential recovery programs, sometimes ex-offenders. And we have a 7-component program. One of those components is processing past trauma and family issues. And the idea is all of these are interrelated. So, if you have difficulty managing thoughts or, toxic core beliefs, that relates to trauma, difficulty managing emotions and healthy relationships and support network, and your physical health and boundaries and self-care and job, financial health and career marketability, all those things, if you're able to process your trauma, then you're going to have progress in those. And the summary of what we tell people is you first have to establish safety in your life, then you go deeper into processing. Now that somewhat varies depending on the type of trauma treatment you can do. EMDR is fairly low risk type of treatment, but a lot of people, what they do is they try to process their trauma really quickly in their recovery model, and that risk relapse. So we encourage folks to work through their trauma in individual and group counseling, And ultimately, what that's going to do is decrease emotional volatility, health issues, addiction issues. It's going to help reestablish core beliefs and self-image, and that's what we're trying to do. And this fits into, and I'm not going to go into all the details, the larger holistic wounded healers model, where we have a lot of different courses that will help people develop this, but we also help people develop their own plan for long-term relapse prevention. So that's on the personal trauma recovery, and then you have the clinical trauma counseling. So our approach typically across our counseling courses is we're going to use one book that's going to be kind of like a core textbook that is usually kind of the industry standard. So for our graduate courses, we're aligning with KCREP standards. We're not a KCREP program, KCREP approved program, but we're using KCREP aligned textbooks. But then we use a book, Restoring the Shattered Self, which is a Christian counselor's guide to complex trauma. So that's actually designed to integrate fairly well with this book. And then we also use, tip 57 on trauma-informed addiction counseling. So that's how we approach the clinical perspective. And, what we're trying to do is to help people heal and train people so that they can, help others heal from their trauma experience. But how do you have a whole organization? So you may have the world's best counselors in the world, but if your organization is just way too intense and, your counselors are getting re-traumatized, or it's not safe for the clients for, various reasons, you have to get the whole organization to be safe. And that's where you go into trauma-informed care in organizations. And, this is, the tip approach that you have to have, trauma-informed care across all these different domains. So that's what we're trying to do in a lot of our organizational management courses. So hopefully this is helpful, and you can connect this with how we approach trauma-informed care across our courses. Thanks.